Okay, I'm live. If whoever's live right now, let me know you can hear me well. Okay, I'm just gonna wait a little bit for people to tune in. Has it been 30 minutes yet? Let me check. Hi, Simona. Okay, let me see. Looks like I'm live on Facebook. Let me know that you can hear me well. And let me see. I'll make sure I'm connected. All right. Yeah, can you guys hear me well? Let me know. Hi, Stefan. Here's my sticker. Yeah, we can hear you. Okay, good. Good. Doing great. Okay, so I am gonna get started just with this video. My camera is there, but I'm talking to the screen here. But anyway, so I wanna just give a brief introduction about my sister and I. So my sister and I, we share the same Facebook, and together, hi Amber, thanks for joining. So together, my sister and I are immunology cancer researchers and nutritionists. We specialize in the immune system and cancer. So we help people who suffer from chronic health challenges overcome that and ultimately get off medications through diet and nutrition. So I've worked in cancer research field since 2010. So this is my 8th year working as an immunology cancer researcher. And we are developing immunotherapies where we take patients' immune system and make it stronger to fight against cancer. And that's more complicated than that, but that's not the topic of this video. So in this video, I'm going to first address the key driver of cancer growth and then what you could do about that. So there's a lot of questions that people often ask us is what causes cancer? And obviously, there's not one thing that causes cancer. And every doctor learned back in medical school the main biochemical cause of cancer and what differentiates a cancer cell from normal healthy cell. So cancer, above all diseases, has countless secondary causes, and that is what I'm going to talk about here. So almost anything can cause cancer. Hi, Tatiana. Thanks for joining us. But even for cancer, there's only one prime cause, and the prime cause of cancer is a replacement of the respiration of oxygen in normal cells by fermentation of sugar. In every case, during cancer development, the oxygen respiration always falls and fermentation appears, and the highly differentiated cells are transformed into fermenting anaerobes, what I mean by that is that they lack oxygen, and which has lost all their body functions and retain only the useless property of growth and replication. So does this make sense? So what this means is that cancer metabolizes much differently from normal cells. Normal cells love oxygen, and cancer cells hate oxygen. And that is the key here. That is what pharmaceuticals don't want you to know. Jen said kind of makes sense. So it's quite simple. So another thing that this tells us is that cancer metabolizes through a process of fermentation, kind of like yeast and mold. So that is why metabolism of cancer cells is 8 times faster or greater than the metabolism of normal cells. So if you don't address the key driver, it doesn't really matter what you do. So if the lack of oxygen is a key driver of cancer cells, then so is low carbon dioxide and pH levels. So what I mean by that is that, again, cancer thrives in the acidic, low oxygen environment. Did you guys get that? So doctors treat neither the underlying cause of cancer nor the conditions that cancer cells love. So I can show a couple of case studies here, but what I'm trying to say here is the key drivers of cancer, again, I'm going to repeat, it is a hypoxic environment, which is a low oxygen environment, and acidic environment. And what ultimately causes that in a body is that acidic environment is caused by environmental factors. There's certain things that we cannot control, But what we can control is the food that we eat. So highly alkaline food, which is a raw, dark, leafy vegetables, is high in oxygen and is alkaline. And that is what cancer cells hate. They hate the oxygen-rich environment and they hate the alkaline environment. Unfortunately, most people's diets is highly acidic because they eat the acid-forming foods, which is processed foods and breads and pasta. And of course, they're not getting enough oxygen by not eating enough oxygen-rich foods. And oxygen-rich foods are dark leafy vegetables. So that is what the cancer, the prime factor for cancer growth. Does this make sense? Let me know if you guys have any questions about that. Hello. Camera's better. But I'm looking at the screen to see your questions. So anyway, I want to give a little bit of case studies here. The radiation oncologist, Dr. Michael Milosevic of University of Toronto, he measured oxygen levels of 247 men with localized prostate cancer prior to radiation therapy, followed them for a median of 6.6 years. And so what he found is that low oxygen in the tumors predicted early relapse after radiation treatment. It is the only identified factor that predicted local recurrence during follow-up. And so we do not need new drugs to target hypoxia in tumors. You can address that by creating an oxygen-rich alkaline environment through diet and nutrition. And does this make sense? And also Dr. Rockwell from Yale University School of Medicine studied malignant changes on the cellular level. And he said, and I quote him, the physiological effects of hypoxia and the associated microenvironment inadequacies increase mutation rates, select for cells deficiency in normal pathways of programmed cell death, and contributes to the development of an increasing invasive metastatic phenotype. So, in other words, just like I said, the hypoxic environment and highly acidic environment is the primary driver of cancer growth. In addition, Professor McKenna, director of UK MRC Gray Institute for Radiation Oncology and Biology, said that by oxygenating the cells with a better blood supply, we enable radiotherapy and chemotherapy to do a better job at killing them, at killing cancer cells. So, move your camera closer to your beautiful face. Thanks, Tatiana. Okay, so Simona asked, yes, so just fruits and vegetables? Not just fruits and vegetables, there's a lot of other foods that are alkaline. So the key is to create a more alkaline, oxygen-rich environment in your body, because ultimately cancer cells cannot survive in the oxygen alkaline environment. And that is why cancer cells, they act like fungus, and because they switch to fermentation process. And that's why cancer cells love sugar and processed foods. And that is for pharmaceuticals, they target a specific pathway. Chemotherapy targets a specific pathway, mutation pathway in the cancer cells. But as we know, cancer is not caused by one thing. There's many different things going out of balance. That is why you can address every single type of mutation and actually prevent it to an extent by eating more alkaline rich foods and creating more oxygen rich environment in the body. And that is what can decrease a person's rate of developing cancer even though they may be predisposed to it. Does this make sense? Chlorophyll, yes, Amber, chlorophyll, alkaline. Molly is asking, what are the changes of getting better without changing our diet? It's a complicated question. It just really depends on other factors. And also, if I'm understanding, both nutrition, chemotherapy, radiation works. Because it really depends what the doctor suggests, because in some cases, chemotherapy can be life-changing for a person if they don't have, there's no other way for them to, they stage 4 cancer and there's no other way for them. And the chemotherapy is the only thing that can aggressively kill all of the highly mutated and aggressively multiplying cancer cells. But you can assist your body in fighting cancer by creating more alkaline and oxygen-rich environment. in combination with chemotherapy or radiation if that is what the doctor recommends to go through. However, the side effects of chemotherapy and radiation are just, they kill everything, not just cancer cells. It's extremely horrible side effects. Can gene mutation be reversed? Because the thing is, as we get older, certain genes get activated and certain genes get turned off. So our lifestyle, Simona, it's a really good question. So during our lifestyle, we can actually activate our genes by following a certain lifestyle, by eating more alkaline-rich foods, by practicing meditation, lowering stress levels. We can decrease the activation of certain genes. And whether you can, it depends what kind of genes you can reverse, but people can reverse diabetes by following a lifestyle approach. So certain genes can be reversed through lifestyle changes. And gene mutation, not sure about all the mutations, if that's even possible. Certain mutations, I don't think, if it's already mutated, then you can stop the progression of it mutating further by basically creating a bulletproof environment in your body that is not allowing for the progression of the disease. Does this make sense? Hi, Amanda. Nola's asking, can you prevent the growth of cancer and how long would it take? That's a very tactical question and very specific. It really depends on the person, depends on the individual. But what pharmaceuticals don't want you to know is that the highly oxygen-rich and alkaline environment is what the primary driver of cancer growth. Yes, Simona. So you can stop the progression in many cases, the progression of the disease by making lifestyle changes. Lifestyle changes, dietary changes. You cannot reverse the mutation because it's already happened. But because cancer, there's so many different things go wrong in the body that by targeting with just one single drug, it most likely will not kill it. It will put the body in a remission, under control, but it will most likely will not kill, because sometimes cancer cells even go down to the stem cells. Tatiana asking, I had amazing results with someone I coached with prostate cancer. He switched to a completely vegan, high-raw food lifestyle and implementing meditation in his daily life. His PSA values went down like crazy, and the specialists didn't know what happened just after 3 weeks. Yes, how important the raw foods are, exactly how important alkaline and high energy, oxygen-rich foods are. Alina asked if cooked food can heal. For healing, cooked food is not the best for healing. The best thing that we have seen and that other people have done is through raw foods. Alkaline, mineral-rich, really high nourishment type of raw foods. So not just fruits, but lots of dark leafy greens and vegetables. So cooked food cannot heal, really, when the person is really sick, such as if they have autoimmune problems. It is raw healing foods. Okay, you guys have any other questions for me? Does this make sense? So basically, summarize. The primary driver of cancer growth is the hypoxia, which is an acidic environment, and unfortunately most people's environment in their body is highly acidic due to stress, environmental factors, and diet, of course, plays a huge role. That creates this acidic environment. People are highly acidic, and that is why when people switch to a different type of diet, they start having problems because they're not accustomed to it, to switch. A low oxygen environment. So eat more oxygen-rich foods, which is dark leafy greens, is a primary source of high mineral-rich diet in the raw form. Hi, Louise. Hi, Janine, Mary. So Simona asked, even bacteria and viruses can activate cancer cells or gene mutation. That's correct. So women who have had papillomavirus infection, HPV, they have a higher risk of developing cancer, cervical cancer, because the virus is causing so much damage to the tissue that the cells become more mutated. So they have a higher risk of developing cervical cancer if they get a virus infection, HPV. Because HPV is causing damage to the cells, and yep, correct. Good question. Again, so the key is to create a strong immune system. So viruses and bacteria cannot thrive in your environment. What about it? What about Steph? Yeah, if there's enough damage caused to the body by the virus or bacteria, then it can lead to mutations in the cancer. As well as if the virus is able to integrate into the DNA, and it integrates in the position of an oncogene, if it integrates in the area of the gene that causes cancer, and it will activate the gene. So if the virus actually able to integrate into the DNA, it can cause cancer, and they actually did the research on that before, where they gave people retroviruses that carried cancer therapy, and then the retrovirus integrated into the DNA next to the oncogene, and it helped with one type of cancer, but it activated the other type of cancer because it integrated into the genome. That is why clinical trials with retroviruses and lentiviruses, because lentivirus causes a really high side effect, anti-inflammatory response. It has huge side effect. And then retroviruses, they integrate into the genome. That is why these viruses are no longer used in the clinical trials, because they can accidentally integrate into the genome and activate an oncogene, a cancer-causing gene in the human body. So it's not a ideal type of vector to deliver therapy. Because a lot of research I have done in the past of staphylococcus infection, they can bring to septicemia. That's interesting. I have not read about staph, so I don't know the relationship in regards to staph specifically. That is interesting. Okay, does this make sense? Who else is online? Let me know if you guys have any questions. Good question, Simona. Like, great questions you're asking. Yeah, but that was the main. Oh, there was also another research done by. Okay, there has been work going on using bicarbonate, so baking soda, as a potential treatment for cancer. Dr. Robert Gilias and his colleagues at the University of Arizona have demonstrated that pre-treatment of mice with sodium bicarbonate, so baking soda, results in the alkalization of the area around tumors. This type of treatment has been found to enhance the anti-tumor activity of other anti-cancer drugs. And bicarbonate increases tumor pH and also inhibits spontaneous metastasis. And bicarbonate is alkaline, and that is what they're trying to do, is target cancer by creating more alkaline and oxygen-rich environment, which you can do through diet. It doesn't have to be through baking soda. I don't think it's effective, honestly. Jim, hi Jim. Will you marry me? Hi Melody. Hi Kira. Hi guys. Okay, so cool. Simona says that cool because even activation of gene mutations from staph infections, if I remember, is well related. And as you were saying, mutations and viruses integrating into the DNA could promote cancer growth. Yes, exactly. If a virus is able to integrate into the genome, as viruses tend to do, then they can integrate in the area of the chromosome DNA that is next to the oncogene or cancer-causing gene and actually activate a certain gene that promotes cancer growth. And that is why viruses are not used in clinical trials anymore, because too dangerous, too many side effects. Tatiana, thank you for the talk and keep on doing what you're doing. Thanks for your kind words. Hi, Yuri. Okay, I'm gonna to head off. Who puts my face? All right, guys, I'm gonna head off. If you don't have any more questions for me, but I hope this makes sense. Reverse this video. I'm gonna keep it alive for maybe like 1 or 2 days, but it's quite simple. And pharmaceuticals, they try to target one specific area to kill cancer, but there's so many different mutations that happen that it's very difficult to actually kill it all together with the chemotherapy. Yeah, Simona, if you're asking about the autoimmunity, if NANA, everything else comes negative, then you most likely don't have autoimmunity. But if your doctor recommends any other tests, then that's what I would do. But if NANA comes negative and all NACA, anti-DNA, NANA comes negative, then most likely don't have autoimmunity. Jim is so funny. Hi, James. Jim is saying, let's go on a honeymoon, juice lots of honeydew. Okay, man. Okay, is it a good idea to do a gene mutation map? Yeah, I mean, you could do that if you can. Can you pay for that, or is it free for you? I don't know. Because you live out of country, I'm not sure if that would be it. You can do it, but again, that's you don't want to psych yourself out. That because certain people, they're predisposed to certain type of cancer genetically, but environmental factors play a greater role, I believe. So you can do a gene mutation map to see if you have a greater risk of developing certain type of cancer. But again, the best way, in my opinion, to do it is through creating a more alkaline, oxygen-rich environment and following a healthy lifestyle. Hi, Brent. Okay. Okay, I have to get off now. Thank you guys for joining, and rewatch this video really quickly and let me know if you have any questions. Cool. Thanks for your questions. Bye-bye.